Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the Final Frontier podcast. My name is Dr. Emily Gerby.
And my name is Dr. David Friedberg. Today, we're breaking down a foundational neuro topic. It is going to be upper versus lower motor neuron lesions. All right, let's hear the question. A patient presents with increased tone, exaggerated deep tendon reflexes, and a positive Babinski sign. Which type of lesion is most likely present? Is it option A, Guillain-Barré syndrome, GBS? Option B, cerebrovascular accident, a CVA? Option C, Bell's palsy? Or is it option D, spinal muscular atrophy, or SMA?
All right, let's dive into each of those option choices before we get to that correct answer. So first up, option A was Guillain-Barré syndrome. Now, GBS is classified as what? Is it an upper motor neuron or a lower motor neuron lesion? If you said lower motor neuron lesion, that is correct. It is a lower motor neuron pathology caused by acute demyelination of the peripheral nerves. It presents with things like flaccid paralysis, diminished or absent reflexes, and muscle weakness. Remember, our patient here had increased tone, positive Babinski sign, and exacerbated reflexes. So at this point, I'm going to cross off GBS. Next up, we had option B, a CVA, also referred to as a stroke. Now, a stroke is a central nervous system lesion, meaning it is what? Upper or lower? Yep, it's an upper motor neuron lesion. So some of those classic signs of upper motor neuron lesions are what? Yep, increased muscle tone, right? Spasticity, exacerbated DTRs or hyperreflexia, that positive Babinski sign. Remember, that's the extension of the great toe. So these findings occur because of the descending inhibitory control from the brain to the spinal cord. It is lost, allowing reflex activity to become overactive. So since we're seeing that overactivity, that heightened response with this upper motor neuron pathology of a CVA, option B is in fact the correct answer choice. Let's talk though about why C and D are incorrect. C is incorrect, which is Bell's palsy, because Bell's palsy is also a lower motor neuron lesion. It is in fact an isolated lesion of the cranial nerve. Do you remember which cranial nerve? Yeah, cranial nerve 7, our facial nerve. It causes flaccid paralysis now of those facial muscles on the entire affected side. That's a big difference here, right? With Bell's palsy, it is going to be flaccid paralysis on the same side of lesion, the affected side. We would not see hyperreflexia or spasticity because, again, remember, it is a lower motor neuron pathology. And then finally, we have SMA or spinal muscular atrophy, which was option D. The reason this is incorrect, because this is also involving degeneration of the anterior horn cells, which is the lower motor neuron pathology. Since it's lower motor neuron, what are some of those symptoms we're going to see? Flaccid weakness, atrophy, and hyporeflexia, not necessarily increased tone or increased spasticity. So remember, warriors, the biggest takeaway here, when looking at each option choice, first identify which is upper motor neuron versus which is lower motor neuron lesion, and then look at that question stem. What did the question tell us? Are those symptoms upper or lower motor neuron? That should be your first step to help you get to the correct answer choice.
So now let's talk about some quick ways to remember this. So the upper motor neuron lesion, you want to remember spasticity, hyperreflexia, minimal atrophy, and a positive pathological reflex like Babinski. And now lower motor neuron lesions, that's going to be flaccidity, hyporeflexia, significant atrophy, and fasciculations. Say that 10 times fast. And remember, tone and reflexes go up with upper and go down with lower. That's the easiest way to remember it, especially when you're coming down to the pressure of this examination.
Biggest takeaway here, Warriors, don't just memorize. Connect the clinical presentation to the lesion location, especially using that little tip and trick that David just gave you. That's what real clinical reasoning looks like.
Now that you heard our podcast, here is a quote from Frank Sinatra. The best revenge is a massive success. So, who are you going to get revenge on? Maybe it's yourself, negative thoughts. Maybe it's those naysayers out there. Go prove every single one of them wrong. Get your goals, get your dreams, get what you want and what you deserve. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, Twitter, and X.
Till next time, have a great day and a powerful tomorrow.